Good morning. I'm Susan Cosgrove, and I will be your host for this episode of our live stream show, My Diabetes HQ Live. People with underlying conditions such as obesity, prediabetes, and diabetes are at greater risk for COVID-19 complications, but effectively managing these conditions can reduce that risk. The National Diabetes Prevention Program, also known as DPP, successfully helps at-risk patients delay or completely avoid developing diabetes and take control of their health. Across the country, providers and diabetes educators have been adapting their programs to follow social distancing guidelines and stay-at-home orders. Building upon our previous program about DPP, we'll hear more about a bright spot during the pandemic, a thriving virtual DPP program in Philadelphia. Today, learn more about diabetes prevention programs, the impact of health disparities, and the benefit of building virtual communities. Stay tuned. Our episode is coming right up, and you don't want to miss it. Before we begin, a gentle reminder that the content shared during the My Diabetes HQ Live broadcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical conditions. The weekly broadcast is developed and produced by Cities Changing Diabetes volunteers in Houston and in Philadelphia. Both cities are the two U.S. members of a global network of 35 cities working to improve diabetes prevention, care, and management around the world. You can learn more about Cities Changing Diabetes by going to citieschangingdiabetes.org. The purpose of this live stream is to help people with diabetes and their support teams, and today we're talking about the role that virtual DPP programs can play in diabetes prevention and management. Leave a comment, share where you are, and join the conversation. So back in September, we had the pleasure of being introduced to the diabetes prevention programs during our discussion with Marcy Witherspoon from the Health Federation of Philadelphia and Richard Bird, a recent DPP completer. The Health Federation's DPP classes are part of a larger initiative in Philadelphia, the Philadelphia Diabetes Prevention Collaborative, which is led by Jefferson College of Population Health to increase availability and enrollment in DPP. I'm excited to introduce today's guests from the Jefferson team who will share more about the broader efforts and the success that Jefferson has had in delivering programs virtually. So first, I'd like to introduce Dr. Mitchell Kaminsky, who's the Program Director of Population Health at Jefferson College of Population Health. Good morning, Dr. Kaminski.
Good morning, Susan.
Thanks for joining us. Next, I'm going to introduce Dr. Neva White, who's the Executive Director for the Fraser Family Coalition for Stroke and Education Prevention at Thomas Jefferson University Hospital. Morning, Dr. White. Welcome to the show.
Good morning. Good morning.
And finally, joining us, we have Lisa Richardson, who is a DPP participant at Jefferson's. Welcome, Lisa.
Hi, good morning.
Good morning. And as always, we are joined by our fantastic My Diabetes HQ team member, Serena Valentine, who is the CEO of Core Initiatives and Houston's Diabetes Peer Support Initiatives Program Coordinator. Good morning, Serena.
Good morning.
Well, welcome everybody to My Diabetes HQ Live. We're so excited to have all of you here to talk about what Jefferson's doing and to really highlight this bright spot in kind of the way that you've been able to adapt and deliver your virtual programs. So, Dr. Kaminski, I want to start with you. Could you just begin by telling us about the work generally that you're doing on behalf of patients with prediabetes and how Jefferson is really taking the lead in diabetes prevention efforts in the Philadelphia region?
Absolutely, Susan. I wanted to thank everyone for joining to hear about our program and to improve your lives. I work at the Jefferson College of Population Health, and about a year and a half ago, the college got involved with the American Medical Association on an initiative to promote the diabetes prevention program. So we formed a collaborative with the AMA. We also have involvement with the American Diabetes Association and the CDC. And our goal was in our 5-county Philadelphia region to enlist 2,000 additional patients in the diabetes prevention program in 2020. And our goal was to get half of those referrals from physicians. My involvement personally, I'm a family physician, Susan, and I've got to tell you, before getting involved, my focus was really on treating diabetes. There is so much diabetes that as a physician, I was focused on that. And when I heard about all this effort for pre-diabetes, I really questioned the priority. But personally, I got involved and I met Neva White, Dr. White, who runs our programs, and attended some of the sessions. I was blown away. I like to say I drank the sugar-free Kool-Aid of DPP. And once that happened, I've been speaking with patients and with physician groups and really promoting prevention of diabetes, because it makes so much more sense to do that and to reduce the number of people who are struggling to treat their diabetes.
Yeah, that's great. And before we talk about what the DPP program is, could you share a little bit more, like your perspective as a physician? You know, what did you find most compelling? And as you go and talk to physician practices, you can get that buy-in, so physicians will refer their patients to DPP. You know, what are the key messages that really cause people to stop and think, like, yeah, this is a great program, I should be referring my patients?
Sure, I found a lot to be compelling. One is once I learned about the DPP program, and once I attended some of Neva's sessions and interacted with patients like Lisa, who you're going to be meeting later, I realized that I could look my patients in the eye who had prediabetes and tell them, you don't have to get diabetes. Suddenly, I met all of these patients who were successfully changing their lifestyles and reverting their prediabetes through exercise, losing weight. So that was one of the biggest insights that I had in my involvement with DPP.
That's great. Neva, do you want to share a little bit about the messages that you use to convince physicians and others that this is a really effective program?
I think one of the most convincing things are the participants themselves. I always ask them to go back and tell their providers their story, tell them their experience. And we have, Dr. Kaminski and I have been going to grand rounds. We've been talking to physicians. You know, oftentimes I'll meet with them in groups to try to explain some of the work that we're doing. But our best way of getting this is the participants. They're our best spokespeople.
Mm-hmm. And we're so lucky to have one of your participants, Lisa, with us here this morning to share about her journey as well. So before we get into that, Dr. Kaminski, I want to throw it back to you to just give us a little bit of history about kind of how the DPP got started, the evidence behind it, and really what it is and what it looks like.
Absolutely, Susan. Some background, first of all, is that there is a lot of diabetes in our country. There are 34 million patients with diabetes. 1 out of 5 of them don't know they have diabetes. But that's just the tip of the iceberg. 88 million American adults have prediabetes. That represents a little more than a third of the population in our country have prediabetes. And of them, 1/10 of them are not aware of their diagnosis. Actually, I flipped that around. 1/10 of patients with diabetes don't know they have diabetes, but 1/5 of patients, or 20% of patients with prediabetes, are not aware that they have prediabetes. The DPP program has actually been studied for about 15 to 20 years. It was a pilot program initially established by the CDC. I think we have a slide about that too. And in that pilot program, they really wanted to understand how best to prevent diabetes. And so in the 1990s, like any study, they had a placebo group. They had a group that got metformin, a drug that's frequently used to treat early diabetes and continued diabetes. And they developed the DPP lifestyle change program. They discovered as they studied that the lifestyle change program actually had the biggest impact, even more than a medication, metformin. And with that, because it was evidence-based, the government, the CDC, and now CMS, Medicare, and Medicaid are supporters of the DPP program.
Yeah, so really compelling evidence that this lifestyle change program could be as effective as medication in preventing progression to diabetes for certain patients.
Yeah.
Yeah, that's great. So what does the DPP program look like? How long does it take? What are some of the components of the program?
Well, first of all, a person needs to find out if they qualify to participate in the program. What they would be signing up is for a year-long program with classes that are an hour in length. When they sign up for the program, the goal is to achieve reduction of the hemoglobin A1C, which is the 3-month test for diabetes and prediabetes, and to lose 5% of their body weight over the year. The classes are more frequent during the first 6 months. At least 16 classes need to be joined during those 6 months, and then the frequency reduces for the last 6 months, and you have to take a class at least monthly. Now, with the pandemic, the classes are happening virtually, which we're going to talk about a little bit more later.
Mhm. Yeah, so from hearing about kind of the structure of the program, Lisa, at this point, I want to bring you into the conversation since you are a participant in the program. You shared that you recently enrolled to participate again. So obviously, there's something about this program that you find to be really enjoyable and compelling. So why don't you tell us a little bit about your journey to DPP, how you found out about the program, and what you found most helpful about it.
Okay, back in around 2012, I was actually diagnosed with diabetes. My A1C was 6.5, and I was at my doctor for Graves' disease. My thyroid was just out of control. But when all my labs came back, she said to me, "Oh, you're a diabetic." And I said, "No, I'm not." So we looked at my labs and I was like, "Oh, wow, my A1C is 6.5. I can't believe it." So she said, "I'm going to give you a prescription for metformin, and then, we'll talk about it." And I told her, "No, I'm not going to take metformin." She wasn't happy about it, but it was a decision that I made, and I'm not advocating anybody else make that decision. But because I'm a nurse and I have some strict principles about things, and one of them is for some disease processes, I don't believe medication should be your first step. So I told her, well, let me try diet and exercise and see if I can find anything out there. And her response was, all my patients say that. And I said, yeah, I know I've heard the story before, but I'm shocked and I need time to digest this. And at that time, this was me. So moving forward, I gradually started doing some things on my own, and my A1C, was gradually coming down, and I've gone through a couple of endocrinologists, but now my doctor, Dr. Albert Lee, he's been my doctor for 4 years because my previous doctor retired. So we've had some discussions, and I've gone to participated in other programs that Jefferson have. And I've been knowing Dr. White for a long time, back when I was a school nurse. But one of the programs, she did mention it, but I didn't think anything about it because my A1C was coming down, but it just wasn't down enough. And I was dealing with, there's diabetes, well, it was pre at that point, obesity, hypertension, asthma. I found out I had sleep apnea, and I was like, oh my goodness, I'm doing these things on my own. But I was at my doctor's office last year, and I saw the flyer on the wall. And, I looked at it, I said, maybe I should try to participate in this program. And I believe we were the first online class last year. And I said, oh, great, because I'm outside of the city now. So I said, I don't have to worry about traveling at night. But I really got a lot from my first go around. I like the fact that we have a guide, we have a book, and we go over the lessons. It's plain and simple. If you work the program will work for you. So I'm proud to say that in June, this is the first time. Dr. Lee is pretty serious, but you know, we can talk about anything. But this is the first time he was actually excited and rooting me on, because I told him what my goal is for next year. But my A1C is 5.6 now. And I attribute that a lot to the program, you know, this diabetes prevention program. If you stick with it and work the program, it works for you. And it's simple. It's not always easy, because, you know, you have those times when you want those snacks or whatever it is. But a lot of times I go back to the book and study, you know, a lesson. And I've, you know, have good camaraderie. We have an excellent group. This time we had one last time. And I've, you know, befriended a couple people, but during our lessons, we really have good discussions. We have visits, and Dr. Kaminski came to our session one time, and it was just awesome. And he shed some light on the situation with the prediabetes. So, you know, I tell people, if you're a pre-diabetic, do something about it, because you don't have to become a diabetic. If you stick with it, and you have to make up your mind, nobody else can do it for you. You must do what you need to do. And, you know, it's a free program. And, you know, you have to tap into your other, you know, resources when you're not online with your other, you know, peers, or with Dr. White or whoever guests. So that's a little of my story. But the program is excellent. And I tell people, and I'm trying to get some of my family members on board, and I tell them, you've been knowing me all my life. Look at me and think of, you know, how I used to look. But I'm more healthy. All of my labs are perfect. So, you know, I haven't gotten comfortable with my 5.6, because it's just a notch under the pre. So I'm looking forward to February to see what it's gonna be. But you really have to stick with it. It's not a one and done. This is a lifestyle change that it continues for the rest of your life. And I plan on living much longer.
Thank you so much, Lisa, for sharing your story. I think there's so much about your path to DPP that is really inspiring, and certainly kind of starting your story from that place of self-advocacy. Like, that's something that we talk about all the time here on MyDiabetesHQ Live is, you know, working with your care team, knowing kind of yourself and knowing what you want for yourself. And it just sounds like you are such a great advocate and have gained so much from this program and are now like an advocate for the DPP program. So Dr. White, I want to give you a chance to weigh in as well here about the DPP, kind of about different patients' paths and stories to getting to you, and kind of what you see and what you take away from Lisa's story as well.
Well, we started in 2019 with our distance learning virtual program. We just did it because we were finding that people were having a lot of barriers to getting to class, and the weather, and, you know, and so, you know, we started that program. And then in 2020, we actually started in February. But what happened was something we really didn't imagine. So we enrolled about 32 people at that time. And I think this whole idea of connectedness and being together, it served as a comfort, particularly during this time when everything was going on. And so what I'm finding is that our enrollment and the amount of people who are just coming consistently to programs, it's just amazing. It's amazing what has happened as a result of what's going on in the world and how we can build community virtually. So we have many people in our class who have similar stories to the one that Lisa just told, but I think it's each person telling their stories and learning from each other that is the real success of this program.
Yeah, that's great. And I think really we'll get more into this, but to your credit, kind of being ahead of your time, I think, in establishing these virtual programs before everybody shifted to virtual gave you a really great head start too. So Serena, I would love to hear from you here. We're hearing about this importance of the virtual community, connectedness. How are you seeing that play out in your work and your life?
Okay. First of all, I want to say, Lisa, yay, 5.6. Congratulations on that. But yeah, sure. Like everyone, probably before pandemic, everything you're in person because that was the thing to do, because in person you're face to face, more personal, all of that stuff. But of course, we definitely had to switch peer support to online, simply because, well, as soon as everybody went to lockdown, I started getting phone calls from all of our locations saying, "Oh, sorry, Ms. Valentine, but we're shutting the center down, or we're shutting the location down." And so it did take me a while to it took me maybe about a month after lockdown started to try to rearrange everything and get everything set up so we could go virtual. But we did that, and the people I get now are just like, "Oh, this is great. I can do this from home. I don't have to sit in traffic," because y'all in Houston, y'all know traffic is bad. But yeah, it's there are some good things about it, and there are a few drawbacks, but we're doing what we have to do, for the time being. We can't control what's going on with the pandemic, so
yeah. And to follow up on that, what are you seeing as some of the drawbacks, and how are you addressing that? I think you're right. Like, this is the world that we're living in, and so we're doing what we can, and I think successfully delivering virtual programs is a big piece of that. But what are some of the challenges?
Well, from what I've seen, a lot of the people who normally come to get peer support, they want that face-to-face connection. They want that in-person, communication, conversation, and it kind of makes people feel a little more close when they're physically close to you in person. But I try to do my best to kind of lighten the mood when we're on meetings for peer support, and just try to get them to even talk about their feelings concerning pandemic, and then people loosen up a little bit, and then they feel a little better about what's going on, and then they continue to come, and I try to encourage my folks to always cut their video, their camera on. Some people are not going to do that. I know that some people just want to kind of sit back and watch and listen. But I try to encourage them to, cut the camera on so we can see you and we can see each other, so it won't just feel like, oh, I'm just dealing with voices. This is really not real, So yeah, that's the drawback for the folks who really want that team family feeling. But they're still coming, so obviously there's a need for it, and they're taking it up on it.
Mm-hmm. And Neva, do you see similar challenges with your program?
Yeah, I was just thinking when Serena was talking, I was just thinking about when people that mute themselves, they'll mute their video, and then all of a sudden you'll say something and it'll strike a chord, and then they'll come on, and they'll express themselves,
Yeah.
Especially folks who maybe haven't been doing a lot of participation.
Mm-hmm.
That really hit me when you said that, because we've seen that happen so many times in class. I think the biggest challenge is the digital divide, people not having access to getting on the platforms, the various platforms. We use Zoom. And so we spend a lot of time one-on-one, really making sure, first of all, that people even have a device They're able to connect on their phone or wherever or whatever they're going to be using. But I think that's the biggest challenge with this is this digital divide. But what has happened, I think what has come as a positive side of it is that I think people are a little bit more comfortable with this whole idea of telehealth. And so by us getting together doing the DPP this way, we really encourage people to go ahead and make an appointment for a telehealth visit with your provider. And I think this has added a level of comfort.
Yeah, that's a great point around how, if you're using DPP like as this entryway to interacting with a care team virtually, it really can help patients feel more comfortable if they're going to be seeing their primary care provider via a telehealth visit. Are you seeing this at all, Dr. Kaminski, with your patients? Are you seeing patients via telehealth?
Yes, we are, especially in March, April, and May. Almost all of our visits were virtual visits.
Mm-hmm.
And I was surprised, actually. When I started having telemedicine visits with patients, I thought it would be second rate to face-to-face, but there are actual benefits with telemedicine visits that you don't get in face-to-face. The convenience, the reduced cost, you don't have to worry about paying for parking, accessibility, and the follow-up that you can do through patient portals in the EMR. So I really was impressed. The other thing I was surprised about with the telemedicine visits is you really can develop, as a provider, a relationship with the patient. And I was surprised by that. I was, diagnosing anxiety or depression over telemedicine visits with patients. They were really opening their hearts. The other thing is you could see the patient's environment. I really understood what it meant when a patient I was seeing and working on caring for some chronic diseases was distracted by a grandchild toddler that was on the floor behind her, trying to have this telemedicine visit and keeping an eye on a toddler, and realized this is her life at home. If she came to the office for an appointment, she wouldn't have brought that toddler along. She would have had to get some child care. But I had a greater appreciation for what her life is about and why she might miss an appointment if she has these other family obligations.
Yeah, and so telehealth and virtual programs offer this window into the lives of patients and people living with diabetes. And Neva, I want to go back to you on this question because I feel like you have shared in the past kind of how you've seen that play out with your DPP participants as well.
Oh yeah, and sometimes it's kind of fun to see talking about something and people can kind of just go get it, or if they need to refer to something. But we had a very exciting meeting on Tuesday, and maybe Lisa could talk about this as well. We had a guest speaker, Dr. Janine Carrillos, a provider who really focuses in and specializes in weight loss medicine. And I wanted to have her come and speak to both of our DPP groups. And I was saying, I'm not sure she can come 2 nights. So we invited both groups to come and hear her speak. And we had 60 people on the Zoom call. And it was just an amazing experience. Lisa, maybe you could tell them how it felt on your end. But I was so excited that we had her there and we could ask questions. And I was just so excited. I'm not sure, Lisa, can we?
Well, I'm familiar with Dr. Carrillos. I went to visit her a couple of times, but for me, that wasn't for me, because when I went, I came in the door saying to her, I need help with this problem I have with obesity. And I'm in the pre-diabetic stage, but I was on a plateau for 3 years. And I said to her, I'm not willing to take any medication. I'm not willing to drink a meal. And, so we really talked about it. But when Dr. White said, she was going to be our guest, I was excited to hear, what she was going to have to say. And it was really good. And I was looking at the numbers of the people on the chat, and I was like, oh, well, people are really, and she really gave an excellent presentation, and she talked to us about obesity, about diabetes, pre-diabetes. She talked about different options. And one thing I really liked was, although she mentioned medication and bariatric surgery and all those things, her focus was a lot on lifestyle change and what we eat. And, she was very transparent about herself and her struggles. But I really enjoyed her presentation. It was good. I didn't say anything. I was just observing. But I love it when we have doctors who are real and down to earth and don't talk down to you.
Mhm. That's great. Yeah, thanks for sharing, Lisa. And I think, to this point about building virtual community, the idea of having 60 people who are participating in DPP in one room for a talk like that, I think that's almost impossible to do if you were trying to do that in person, right? You just couldn't get everybody there. You couldn't agree on the time that everybody could come. It wouldn't be possible. And so, that really stands out, I think, as a bright spot of where if you're delivering these virtual programs and you're sort of ensuring accessibility, you can have moments like that where you can get a big group of people together and feel that enthusiasm and that energy. So that's great. So I want to move on to talk about something that I'm sure is on the mind of many of our viewers. We know that COVID-19 cases are on the rise again in the US. And so I want to talk a little bit about the disparate impact of COVID-19, some of the risks specifically to people with prediabetes or diabetes, and sort of how COVID-19 can interact with some of those underlying health conditions. So Dr. Kaminski, I think we're going to start with you on this question.
Absolutely. So what we've learned with COVID is that there are certain risk factors that make you more susceptible to severe disease and to death. We've discovered, we knew about disparities in healthcare and in health in our country. And disparities can be defined, and that slide you just showed as, if you could put that up, Susan. Long-standing systemic health and social inequities that put many people from ethnic and racial minority groups at increased risk of getting sick and dying from COVID-19. So as the pandemic was progressing, we learned that being older and having comorbidities put you at greater risk for serious disease and death. And the morbidities that jumped out the most were obesity and diabetes. If you look at racial disparities in these two categories, obesity and diabetes, you could see on this bar graph, the green bar represents Black patients, the blue bar represents Hispanic patients, the brown bar white patients, and the purple bar Asian patients. And you could see that both for obesity and for diabetes, the prevalence of both of those conditions is higher in the Black population, followed closely by the Hispanic population. And this reflects those disparities. It reflects environment, it reflects poverty, it reflects what we call social determinants of health, which challenge a patient from the time they're born in a community to be able to have a healthy life. It made the DPP program even more important within the pandemic because it was a way that we didn't have to wait for the medical system to start visits again and opening up. It could be a way during the pandemic when patients could get together and address these risk factors, support each other, and really make a change in those demographics.
Yeah. And are you seeing from your patients sort of more willingness and more enthusiasm to enroll in prevention programs like DPP, knowing that there are greater risks with COVID-19 now?
Yes, absolutely. And also, I think because more people are home and relying on connecting through technology, they're even more welcoming to an online program for addressing these factors.
Mhm. And Neva, are you seeing this as well? And the people who are enrolled, your participants in DPP, that there is some awareness of some of these risks and some just desire to make lifestyle changes because of that?
Yes, I think that the primary care provider is probably one of our biggest advocates. We can get more primary care providers to start the conversation and to refer patients, almost like you're giving them a prescription for medication, give them the same prescription for these types of programs. And I think there's a golden opportunity here with distance learning and virtual programming to really expand our reach, and particularly to those people who are living with a bunch of barriers. Because when we think of the old days of having to get on the bus and having to get on the train and having to park and having to, all of the things that we had to do just to get to class, a lot of that is no longer a barrier. So I think convincing people that they can do this, that they can, they can get on the internet, they can be a part of something like this. And once you reel them in and you give them the experience, I think that everything else just kind of speaks for itself.
Yeah, I think that completely makes sense in terms of like the accessibility and kind of removing some of those barriers that would normally be in place for folks attending like an in-person program. And are you seeing that the community, the virtual communities that you're building through DPP, are able to support each other through, all of the difficulties that we've encountered this year, like COVID-19? We've seen lots of unrest and protests and inequalities front and center. Are you seeing the DPP cohorts as supportive of each other through all of that?
I would have to say yes, and especially I would say if we go back to around May when there was a lot going on in our world, and particularly in the US with social unrest. And there were times when I thought about, maybe we should just cancel class tonight. Maybe we all just need to just kind of exhale. However, I found that by being connected and supporting each other, even if, we decided we're just going to talk, we're just going to see how we were all feeling, just to check in. Not only did I find that we were supporting each other, but I also got a great deal of support from the group and encouragement that, no, we're going to keep going. We're going to keep doing this. And what has really inspired me is that here we are in November, and we've maybe lost 2 or 3 people. And even with the people that are no longer attending, we haven't totally lost our connection with them. They've had some life circumstances that are making it a little more difficult for them to connect with us. But in an in-person class, almost at the end of a 12-month program, I never had these types of numbers in terms of retention. So this is an opportunity for retention, support, and really at the heart of it, getting people used to this technology and seeing what the opportunities are to use this technology in a way that we can actually improve our health. And we can really get to the root of health inequity by really doing some systemic things that are going to cause us to really practice what we preach, if you will.
Mm-hmm. Yeah, that's great. And I really want to emphasize this point about retention for your program, because retention really across the board, I think anyone in any place that's offering DPP in the country, retention is a huge issue. I know you have to enroll a lot of patients anticipating that, you'll have a large number of them that for a number of reasons, life circumstances, the fact that it's a year-long commitment, they won't end up completing the program and you'll sort of lose people along the way. And so I think the fact that you've been able to retains so many of your participants is like such a great indicator of the success of your program and how successful you've been in building that virtual community. So Serena, I want to go to you to kind of ask you about your experience and kind of the community building and the community support, like Dr. White was just speaking about, and kind of the participants' willingness to support one another through kind of everything that's happening in life, not just things that are pre-diabetes or diabetes related. Are you seeing the same thing in peer support?
Oh yeah, of course. It's more now than ever. I know peer support, we do have a curriculum, but I kind of deviated from it for a little bit because I started to see where people were really concerned about the pandemic. And um, if you're stressed out about, I always talk about stress and peer support. If you're stressed out about something, then let's talk about it, because you don't want that stress to sit and foster and just sit and kind of brew up some things going on in your body. Eventually it can manifest into physical ailments. So I always tell them, hey, at the beginning of our peer support meetings, we have a sharing segment. So we share, and I tell them to share whatever is on their mind, just share. And actually, me deviating from diabetes for a brief moment, it made everyone open up, even the people who normally just sit and watch and listen. And I say every now and then, hey, are you okay? Everything's all right? Yeah, just listening. But even when we started discussing other things that's going on in the world, not even just the pandemic, but the other things going on socially, politically, all these other things, I give them a chance to talk about it. And so when we talk about it, people open up who don't normally open up, and then that gives me the open door to kind of slide diabetes in there. And so yeah, the community support is very important when it comes to supporting people with any illness. If you think about it, anything chronic that lasts for a long period of time, it's very important that they get support. And so that's what we do our best to provide.
Yeah, and I think that's one of the reasons why programs like DPP and peer support can be so effective, is because you are meeting people where they are. You are kind of paying attention to their needs as whole people. And I think we hear that people who are living with diabetes or with prediabetes, they like settings where they don't have to feel like they're a patient, or where things don't feel as clinical, and there really is this more sense of camaraderie and sense of community that can help empower them to take care of themselves. So I want to talk a little bit about, I think we just briefly touched on this, but just to get into, who's eligible for DPP and how someone enrolls in DPP. So I think we had a question maybe on YouTube from Marianne just about, do you need a physician's referral? Do you need to talk to your doctor if you want to enroll in a DPP? Can you just kind of find a program and enroll yourself? What's the process? So I'll pass that over to you, Dr. Kaminski, to talk about this.
Sure. So you do not need a referral from a physician to participate in a DPP program. What you do need is to meet certain criteria. That would be a BMI over 25. So a BMI over 25 represents being overweight. If you have a blood test, the hemoglobin A1C, the range for prediabetes is between 5.7 and 6.4%. So if those fit with you, you qualify for DPP. You don't have to have a blood test, though. You can go on the ADA side, the American Diabetes Association site, or the CDC. There is a DPP questionnaire, and you can fill out the questionnaire and look at your score. If you have a score of 5 or higher, you qualify for the diabetes prevention program. At that point, you can reach out to your medical home to ask about DPP programs in the area. For our collaborative, we have developed a clearinghouse for our 5-county area to help direct patients to existing DPP cohorts. And I know also the CDC has a site that lists DPP programs in your area, although with the pandemic and changing things, I think that site isn't as up to date.
Mm-hmm. Great. And I think you shared initially when you were talking about the efforts in Philadelphia that, you have this enrollment goal of enrolling 2,000 patients in 2020, but that you wanted half of those referrals to come from physicians. So I think you've touched on this, but just elaborate a little bit more, on the importance of having physicians buy into this program and how they really can be a great channel for enrollment.
Absolutely. And so that's how my practice has changed. Before, hemoglobin A1C above 8 or 9 usually got my attention, and I'd be reaching out to a patient. And those hemoglobin A1Cs right around 6, they weren't diabetes yet. It would be easy to say, I'll just deal with that some other time. Plus, I didn't really know how I would deal with that, other than what Lisa told us about. You need to lose weight, you need to exercise, and most patients can't do it. So it's changed. My practice has changed now. And when I see a hemoglobin A1C in the prediabetes range, or I see a patient who you can tell has risk factors, family history, first-degree relatives, BMI certainly above 30, I have in every exam room now a flyer with the phone number call for the DPP program. And I have the patient take a picture of the flyer with their phone. And I also send a referral through our electronic medical records to Neva and her team at the Center for Urban Studies. And they reach out to those patients. So my practice has really changed a lot when it comes to identifying prediabetes and having something to offer patients. The other thing I wanted to share is one of the meetings I attended, Lisa taught me something and taught the young doctors on our lecture something really important. And Lisa, I don't know if you remember, but I wonder if you could share it. It was about you were telling those young doctors, you have to understand where the patient is and where they're coming from. You may have to deal with other issues before you suggest going to the DPP program. So Lisa, I wonder if you could just share that again.
Yes, I do remember that. I told them, a lot of times when you encounter your patient, especially for the first time, you don't know that person. You're looking at numbers. So if you see a patient who has an A1C of, just say 6, your first instinct is, oh, okay, this person is on their way to being a diabetic. But get to know what's happening with this patient. And I'll take myself, for instance. When I was at 6.5, I was still living in North Philadelphia in a very poor area. And just the stressors alone. I love my, hometown, but just those stressors, coming out of your door, you have to be worried about certain things. I had a ailing mother, et cetera, et cetera. So if the doctor takes time to address, in nursing school, we were taught to do a head-to-toe assessment and always start at the head. Because if the person is dealing with depression, anxiety, stress, whatever, you have to get to the core of that. And if they need a referral, refer them. You can't do everything. And then when you see these numbers out of whack for whatever reason, talk to the patient and see how they're feeling about it and explain to them that, okay, this is your A1C. You're not a diabetic yet. However, these are the tools that you can use to avoid becoming a diabetic. And like Dr. Kaminski said, he has that flyer there. He have his patients take a picture of it, et cetera, et cetera. And, when I was practicing, I encountered a lot of people in the hospital that were, beyond whatever, but I've always been an advocate of educating people. And people usually hold their doctor in high esteem, and they'll listen to what the doctor says. And, I'm constantly, even now, when I talk to people, and they're telling me, and I'm asking them about their numbers, and they're saying to me, oh, it's nothing wrong with me. My doctor didn't know anything. didn't say anything, but I told them it's up to you to know your numbers. And one thing I like about Jefferson is that they have the My chart. So you can go and see your labs before you even go and see your doctor. But it's so important for doctors to find out what's happening in the mind of a person before you start, trying to attack them with all these, other things. But if you do that, and me being a patient, when I was 6.5, I had to talk to myself and say, okay, the doctor has told you what's going on with you. It's up to you to, take on this challenge. Either you want to live or you want to die early. And that's the bottom line. And I'm choosing to live.
Yeah, thank you so much for sharing that, Lisa. And what a valuable experience, for you to be able to share that really critical point with physicians and with young doctors. And Dr. Kaminski, it sounds like that really landed with those folks and had a huge impact. Dr. White, do you want to add anything around kind of DPP referrals and how to kind of make that work?
Yeah. Well, one of the things that we've also found is that our DPP program has really opened the doors for us doing other programming virtually and distant learning. So I think that providers, if there's opportunities to refer patients to any type of health education program where they're going to learn skills, they're going to have the opportunity to interact with others. Of course, we want people to come to our DPP program, but also look at other supporting services that are out here and that are available to people as well.
That's great. So again, DPP and the virtual programming serving as kind of this gateway to kind of all kinds of different virtual programming. So we're getting towards the end of our time here. So I just want to ask, we've heard a lot about how COVID-19 has forced, this switch to virtual programming and sort of the benefits of that. And so if we think ahead to kind of as things return to normal, maybe, in the next year or so, we're able to kind of hold in-person events and classes again. I want to start with you, Dr. White. Like what aspects of this virtual program do you think you'll continue with, even once we're able to meet in person again?
Well, did you say me?
Yeah, please.
Just making sure. Well, I don't think distance learning virtual programming is going anywhere. It's here to stay. And I'm glad that it's here. And I'm glad that it's here to stay. And I always will see this as an option that we can provide people with. And I think that if we're wise, we will create a new normal where we will get more and more people into the digital world, working very hard to close this divide, because that would be a great opportunity for health equity. So if we could look at opportunities to really keep this platform alive and well, and to get as many people as we can connected for now and for the future.
That's great. And Dr. Kaminski, what do you see as kind of the future of virtual programs in DPP?
Actually, I think the virtual programs are better just because of the convenience that it offers to the patient from the comfort of their own home. The sharing, the support you can get from the group, I think it's just as good, if not better, virtually than in person. I think in a future world with the pandemic, it would be nice to have everyone meet in person at least once at some point during the year. But I think I think even if if we're back to in person and driving and paying for parking and all that, I would advocate for keeping the program predominantly virtual.
That's great. And what about you, Serena? What do you see as the future for your programs?
Yes, when she said virtual is not going anywhere, it's really not. It is actually provides so much convenience, as Dr. Kaminski said. It's very convenient. And what I think is, I think we should start looking towards programs that educate, like, you know, the elderly on how to use technology, and putting, you know, programs that put these devices in people's hands who can't really get to it. If they may not have the money, or, you know, they may not have the knowledge to use it. So I think we should start looking towards putting programs together that can educate about technology and put the devices in, you know, in people's hands.
I think that's such an important point. I think accessibility is something that we're just going to have to keep working towards, and always going to have to keep front and center. You know, whether it's the accessibility of owning an actual device that makes it possible to connect, or if it's how to use it, how to make sure that people are not shut out of these programs or other virtual programs, you know, because of those barriers. And I think that will continue to be something, you know, that we all work towards. And Lisa, I want to ask you, you know, I know that you are about to start another round of DPP. So, you know, how do you see participating in programs in the future? Do you like the virtual format and prefer that, and would like to continue with that?
Oh, yes, I really love the virtual format. I'm in the midst of my, you know, second go round. So, you know, at some point in time, I may be teaching the DPP program. I don't know. Anyway, but I like the fact that 30 people can come together on the same platform. From, you know, we have a nice diverse group, and we do a lot of sharing. And with this COVID-19, we've been able to talk about some of our stressors and still do our session related to prediabetes. So I'm hoping that it will continue. This is my second time around. I'm not sure if I would do it again, because I'd rather give somebody else the opportunity. I now have all the tools that I need, and I just need to continue to put them to work and get the word out to other people about the significance of the program, the effectiveness of the program, and, you know, continue to share. Because in my group, I share other things, like I'm a member of the Obesity Action Coalition. I'm a member of TOPS, that's Take Off Pound Sensibly. That's my support group that's year round all the time. And, you know, I'm really advocating for people and for these types of programs. And sometimes I don't want to go out, but I'm always ready to go to my computer. And, you know, I've heard every excuse in the book. And I tell people, if you can spend 3 hours on a computer at a concert with, you know, one of these DJs, you can take 1 hour and do something that will greatly benefit your health. And I'm very transparent with people. I have actually shown people my labs before and my labs now. I, you know, show this picture. And people, a lot of people listen to me. So I'm hoping that the program goes on forever in the virtual world. And you know, you combine it with your telehealth visits, and I'm constantly, every doctor that I have know about the DPP program, whether it's for my physical health or not. So, you know, it's very, very important. So wherever that funding is coming from, please, if people, you know, the patients, we will write letters, we will make phone calls, we will do everything to keep it alive.
And what a great final note to end on, that note of advocacy. And also, Lisa, I promise we will have you back on MyDiabetesHQ Live when you are leading your own DPP sessions. So you committed to that during this broadcast, and we will certainly have you back at that point. So we're in our final couple minutes here. So I just want to take a few minutes to wrap up. So any other final words of wisdom or anything that our viewers should really know if they're thinking about enrolling in a virtual DPP program? And I'll start with you, Dr. White. Final words of wisdom.
Well, I love to take lemons and make lemonade out of it. So this is a perfect time to do something for yourself. Find you a virtual program. Hopefully, if you need a DPP, find a DPP, but find something. And and get connected.
Great, thanks. Dr. Kaminski?
I met with Neva's group. One thing that we talked about is willpower. And what the psychological studies show is it's not about willpower. It's about developing a habit. And the science tells us that it takes 2 months to develop a habit. So I think it gets you in the right mindset when you're trying to change your lifestyle, that you've got a plan for 2 months at least, and that it's not about your willpower, but your ability to get into a routine and a healthier lifestyle.
That's great. Serena?
Yeah, just if anyone's watching and they've gotten a pre-diabetes diagnosis or you're concerned about diabetes, please talk to someone. You can even access the DPP program if you have been diagnosed with pre-diabetes. It's important to not try to go through this alone, because there's help out there and there's people who care enough to teach others about how to navigate through diabetes management. So don't be afraid to reach out.
Great. Thanks, Serena. And Lisa, we'll let you have the last word for today. What words of wisdom do you have for our viewers that are thinking about joining DPP?
I would say don't hesitate. Just do it. And in Philadelphia, there's programs out there, but I'm biased, towards Jefferson. Dr. White has a awesome demeanor, and how she conducts the meetings is very calm and soothing. And think about yourself. We spend so much time trying to take care of other people, do all these other things, but if you are not healthy, you cannot be any good to anybody else. So, and know your numbers. Don't go by, oh, well, my doctor didn't say anything, so I'm all right. Not necessarily true. You have to realize the doctor is a human being who sees many of people. And sometimes it's an oversight, or like Dr. Kaminski said in the beginning, he was only looking at his patients who had 8s and 9s with A1Cs, but you got to catch it early. So if you're looking at your own labs, when you now with telehealth, I know that my doctor only has 10 or 15 minutes with me, so I'll send him a message, what my issues are that I want to talk about. So when we come face to face on our computer, we know exactly what's what and we can cover it. But by all means, and even if you are not pre-diabetic, but your mother, father, grandparents are diabetics, start paying attention and getting connected to programs that can help you, because the probability is high that you will gravitate to these pre-diabetes, and you want to catch it early. And if you are a diabetic, you can live and manage your diabetes and be well. You have to take care of yourself first. It's your responsibility to do you first.
What a great message of self-empowerment and self-advocacy to end on today. Thank you, Lisa. It's been a great start to the weekend with yet another talented panel of guest speakers. And to our viewers, we really hope this conversation has deepened your knowledge of DPP and maybe inspired you to join a virtual community yourself. Mark your calendars, everybody, because we'll be broadcasting again next Saturday at 10 a.m. Central Time, 11 a.m. Eastern Time. That's Saturday, November 28th. We'll hope you'll join us. And on YouTube and Facebook, we have a quick survey where we would like to get your feedback on the program, as well as recommendations for future episodes. So please help us make MyDiabetesHQ Live better by completing the survey. Thank you, everyone, and thank you for being part of our community. We'll see you next week.